Okay, so today this video is going to be more about the muscles, tendons, and ligaments. So this is what a lot of people come in thinking that they've done. So they go, I was working in the yard, breaking leaves or whatever, and I pulled a muscle on my back. It happens, but it's not common. In fact, it's pretty uncommon. The tendons, ligaments, muscle injuries tend to happen in a really dynamic way, high speed. This would be athletes. This would be people in collisions, crashes or something. So there's tons and tons of muscles on the spine, 200 and some odd muscles, 9 ligaments at every level, and then tendons attach one place to another, back and forth. So there's just dozens and dozens of these structures all in there. The disc is technically a ligament, and there's multiple ligaments around it. There's what's called the anterior longitudinal ligament, which contains the front part of the spine, and then there's called the posterior longitudinal ligament, and it's back inside the canal where the nerves and everything go. So there's ligaments that contain the disc. There's ligaments that hold. There's like what's called capsular ligaments that kind of contain the facet joint, and then there's muscles that attach little tiny places together. So there'd be muscles that attach here to here and here to here and here to here. There's multifidus and these deep interspinal muscles, and they can all do things. One of the things we see though in a chronic back patient, especially a person who has long-standing disc problems, is when we look at their MRI, we will see that the muscles, especially the deep muscles, have atrophied. And what has taken the place of those muscles is actually fat. So you get this fatty infiltration of the muscle. That's muscular atrophy. And so for that person to recover, they have to restore that normal muscle function, if at all possible. So it means doing stuff that you probably haven't been doing, moving your spine, bending your spine, twisting in very supervised ways in order to reestablish normal muscle tone, but also size. So if we look at all of these now chronic lower back patients and they come in and they have an MRI, one of the first things I look at in addition to the disc and where the contents of the disc are is how much muscle fiber is left. Is there a lot of fatty infiltration? So these types of things all go into understanding a lower back pain patient, knowing how to treat them, and also giving them something that they can do on their own and able to empower them to take better care of their spine going forward. The biggest issues with muscles, tendons, and ligament issues is just allowing the body adequate time to heal the injury. So, especially with athletes where they have an injury, they really want to go back to competition quickly. And, you have to hit the brakes for them and say, look, let's give it 2 weeks, let's give it a month, whatever, and then go back to competition so that you don't continue to re-injure. In this boat too, there are some other injuries that happen. They're called spondylolisthesis, and basically what happens is there's little fractures that can occur in what's called the pars articularis, which is part of the spine. It's right in there. It's kind of hard to see, but pars articularis occurs in there, and you can fracture that, and then the athlete will have these repetitive pain cycles. It'll be painful for them to extend. It's common in gymnasts and cheerleaders and a couple of other different athletes we've seen it in. I've seen it in basketball players. But most of the time it's pretty high amplitude movements. It's gymnasts, it's maybe football players who've gotten bent back. But that's another thing too. So there's multiple sources of back pain. It's not just one size fits all treatment. People think that there's a magic bullet out there. I think I get 1 or 2 things in my email every day about the magic lower back pain solution. Guess what? There's none. There's no magic. It's time, it's healing, it's being patient, it's not re-injuring it, it's listening to experts, it's doing all of these things so that you can enjoy the best possible outcome. So that's it. That's my little series on lower back pain. If there's questions or comments, please leave them in here. If you got value from these videos, please like and share so that other people can get this information. Thank you.